In 2017, a chilling story began circulating in Nigeria's media space. The National Agency for the Prohibition of Trafficking in Persons had discovered a criminal network involved in the unlawful removal and trafficking of human kidneys. This discovery had led to the arrest of a number of people, including doctors and other medical staff, all accused of crimes related to organ harvesting. About a year later, a mass grave with dozens of bodies belonging to alleged victims of organ trafficking was found in Anambra State. What had started as an underground rumor was quickly becoming Nigeria's worst kept secret. There was an organ trafficking ring operating in plain sight, preying on the most vulnerable of society. An investigation by the Independent Corrupt Practices and Other Related Offences Commission would later reveal a private hospital in Ibadan accused of engaging in illicit kidney transplantation. But how did Nigeria become a hub for this illegal trade? To unravel how deep this rabbit hole goes, we first need to understand what we are dealing with here. First, the market. A report published by the National Library of Medicine noted that at least 27 million Nigerians are living with kidney disease, with about 15,000 new cases every year. Some of the patients were said to be living with hypertension, others diabetes. However, this is not a disease for old people. The incidence of kidney disease cuts across most ages, and the prevalence is highest among patients aged between 20 and 50 years. Some of the leading causes of these ailments, as identified by medical professionals, include abuse of painkillers, consumption of processed foods, not drinking enough water, poor sleeping habits, smoking, excessive drinking of alcohol, and the list goes on. When chronic kidney disease gets worse, it leads to an eventual kidney failure, and this is where things get into the hands of God and those with money. For people that can afford it, they go through something called dialysis, a type of treatment that helps the body remove extra fluid and waste products from the blood. In simple terms, these patients pay a truckload of money for a machine to do the work their kidneys were supposed to do. Most people with kidney failure require like 2 to 3 dialysis sessions per week to stay alive. A session is said to cost around 80,000 naira in Nigeria. So even if you have all the money in the world, you would need to get a kidney transplantation as soon as possible. Otherwise, you run bankrupt. Also, spending 80,000 naira 3 times a week is only buying you enough time. However, since the human kidney is not sold on Amazon or Jumia, and there is no Chinese company that is currently fabricating those, the chances of some of these patients surviving are usually in the hands of good Samaritans who are willing to sacrifice one of their vital organs. And so, patients who are in more pressing need of a replacement sometimes source for this organ illegally by offering money to any willing party. And here is where traffickers come in. Organ trafficking isn't a new thing in this part of the world. In 2020, a man was arrested in Lagos State for allegedly luring individuals with promises of employment opportunities only to abduct and forcibly remove their organs. About 3 years later, in June 2023, the Lagos State University Teaching Hospital was accused of removing the intestines of a 30-year-old patient, Adebola Akin Bright, after he underwent corrective surgery without willfully removing any organ or structure, even though the hospital denied these allegations. The state governor, Mr. Babajide Sanwo-Olu, promised to take up the boy's treatments abroad. However, the boy died shortly after. Same year, about 2 months after this tragic news from Nigerian health sector, another doctor was being made famous. In August 2023, Dr. Noah Kekere was arrested by the Plateau State Police Command after a businessman named Kamal accused him of illegally harvesting his wife's kidney and causing her chronic pain for 5 years. The victim, Kehinde, who was operated on by Noah in 2018, continued to suffer from severe stomach pains after the surgery. It was later discovered that one of her kidneys had been removed during the surgery 5 years earlier. The Plateau State branch of the Nigerian Medical Association denied knowing who this Noah guy was, eventually labeling him a quack, as he was not their registered member. These are just a few examples of the numerous cases of illegal organ harvesting in Nigeria. In poor and vulnerable communities, the promise of fast money lures people into dangerous situations. Desperation leads to deals that can never be undone. For traffickers, it is a simple equation. Organs are valuable and there is no shortage of desperate people willing to risk everything for them. But while the traffickers' motives are clear, there's a darker truth lurking beneath the surface. The victims aren't always willing participants. Many are abducted, sold, or even killed, and their bodies stripped for parts before anyone even knows they are gone. In 2019, the United Nations estimated that over 10% of all organ transplants worldwide were illegally sourced. That is tens of thousands of surgeries each year, each one built on someone else's suffering. And while organ trafficking is a global issue, it is the hidden operations in places like Nigeria that fuel this sinister trade. What makes this trade even more dangerous is that it is often shrouded in mystery. But who are the people behind it all? How could such a large-scale operation exist without being shut down? And how did it grow so rapidly under the noses of Nigerian authorities? To understand that, we need to dive deeper, beyond the victims, like beyond the bodies now. We need to unravel the dark network that makes this market possible. A network of traffickers, brokers, and even medical personnel, all working together to turn human organs into profit. The organ trade preys on the vulnerable. In Nigeria, the victims come from the poorest, most marginalized communities. For them, life is already a struggle, and for traffickers, this makes them perfect targets. But it is not just poverty that makes them vulnerable. It is the promise of hope, of a better life that leads many of these victims into the hands of traffickers. Take the case of Amina, a young woman from northern Nigeria, for example. Desperate to escape her circumstances, she agreed to travel abroad for work, hoping to send money back to her family. But she never made it to her destination. Instead, Amina was taken to an underground clinic where her kidney was removed without her consent. She was left in an unfamiliar city, weak, in pain, and unable to return home. Amina is just one of thousands of people exploited by traffickers. For many, the story ends even worse, with death. These are the lives sold in Nigeria's hidden organ trade, where human beings are reduced to nothing more than their body parts. But who buys these organs? Who are the people benefiting from this illegal trade? This is where the story gets even more complicated. The demand for organs transcends borders. Rich and poor alike need kidneys, livers, hearts, and lungs. For some, the waiting list for legal transplants is too long and time is running out. In many countries, the organ donation system is heavily regulated. But the simple truth is that there are never enough organs to go around. Thousands die waiting every year. And for those with money, waiting isn't an option. This is where the black market comes in. When the legal system fails to provide, the wealthy turn to the illegal, and with millions of dollars at stake, an organ trafficking ring becomes the ultimate solution, no matter the cost. This is not just faceless individuals that fuel this demand. Sometimes the very people you would least expect, public officials, politicians, are caught in the web of organ trafficking. Take, for example, one of Nigeria's most shocking organ trafficking scandals involving a prominent politician. In 2022, the world was stunned when this man, Ike Ekweremadu, a former deputy Senate president of Nigeria, was arrested in London. alongside his wife. They charge conspiracy to traffic a young man from Nigeria to harvest his kidney for their sick daughter. Well, according to court documents, the young man was promised a better life and opportunities in the United Kingdom. But upon his arrival, he realized that he wasn't there for a job. Rather, he was there for a job to be carried out on him. The operation was set to take place in a London hospital, where Ekwemadu's daughter was awaiting a kidney transplant. But before the surgery could be completed, the young man managed to escape. He ran to the authorities, exposing a chilling plot that raised questions about just how far those in power will go to save their loved ones. But Ekwemadu's case is just one of many. Across the globe, from wealthy business magnates to political elites, there are countless stories of people going to desperate lengths to secure a life-saving organ. Sometimes, like in Ekwemadu's case, people are tricked or coerced into donating. Other times, it's not even their choice. On October 25, 2023, a police unit in a community in Port Harcourt, Nigeria, received a complaint from a resident in one of the housing units. On arrival, Nigerians would receive one of the most chilling and horrifying news of the year. A 400-level petrochemical engineering student, Demain Okoligwe, was being accused of murder. But it was the nature of the murder that left people baffled. The victim of this murder was his girlfriend, Justina Otueni, a 300-level biochemistry undergraduate. The accused had killed and harvested her organs for alleged ritual purposes. When the police recovered the remains of Justina, her breast, eyes, and other sensitive parts of her body were all gone. While this murder was reported as ritual killing, sometimes these parts are sold to customers who need them for medical reasons. You see, 8 months earlier, in February 2023, 6 persons were arrested at Nobi, Anambra State, for allegedly killing and harvesting the organs of their victims in Anambra communities. They confessed to being notorious armed robbers and kidnappers, terrorizing this local community. But the disturbing part of the story was when these criminals confessed to selling the male organ of their victims at a price of 50,000 naira to alleged purchasers of human parts in Anambra. Now, while some might argue that these black market surgeries save lives, the reality is far more complex. The process isn't just illegal, it is dangerous. The organs are often harvested in unregulated, unsanitary conditions. Many victims die from botched surgeries, while buyers face life-threatening infections. Even for those who survive, the consequences are dire, and they can be devastating as well. For victims like the young man in Ekwemadu's case, the emotional and physical scars are lifelong. And for the buyers, there's always the risk that they've bought a ticking time bomb. But is this an organized crime? Is there a shadowy network of brokers, middlemen, and even professionals working together to keep this illegal trade alive? In the shadows of society, a vast and complex web of traffickers, brokers, and middlemen moves silently. Each one plays a specific role in the global organ trade, from the person who kidnaps or lures victim to the surgeons who perform the illegal transplants. This is not a random or chaotic system. It is a meticulously planned organized crime syndicate. These cartels are not just a group of petty criminals. They are well structured, operating in multiple countries, and often involved professionals in the healthcare industry, law enforcement, and sometimes even government officials. The trade is facilitated by a network of brokers and middlemen, each tasked with handling different aspects of the operation. But how does this complex network actually work? It starts with the recruiters, the individuals tasked with identifying vulnerable people, those living in poverty with little to no access to healthcare, education, or job opportunities. Sometimes the recruiters pose as charitable organizations or job agents, offering the hope of a better life to the impoverished. But behind these promises is a dark reality. Once a target is identified, they are passed on to the middlemen. These brokers are responsible for making connections between the victim and the buyer. They arrange transportation, logistics, and ultimately the sale of the organ. This stage sometimes involves crossing borders, moving the victim to a foreign country where laws are more easily circumvented. What is perhaps most shocking is the role of healthcare professionals in this trade. There are licensed doctors, surgeons, and even nurses sometimes who take part in this trade. Without them, the entire operation would collapse. These are the so-called white-collar criminals. Doctors who have sworn to save lives, yet secretly harvesting organs for profit. The victims, often desperate and unaware of what's happening, are brought into makeshift operating rooms, sometimes in foreign hospitals or hidden clinics. These facilities are often under-regulated with little oversight, making it easier for doctors to perform illegal surgeries. And the traffickers, they make sure these doctors are well compensated. Behind every organ trafficking ring is another deep layer. Those who make sure the trade runs smoothly. These are the power players. There may be politicians, law enforcement officials, and even border control agents who turn a blind eye to the illegal crossings. For the right price, anything can be arranged. The Ekwemadu scandal showed us just how deeply entrenched corruption is in this trade. But it is not just a Nigerian issue. This network spans across borders, connecting traffickers to international brokers and powerful political figures. However, it's good we know that the organs being sold in this underworld are not just some rare commodities. Behind every organ sold on the black market, there's a human story. A story of loss, betrayal, and desperation. These organs are parts of human lives. Souls being cut short, stories ended, and families torn apart. The organ trade doesn't just affect the individual whose body is exploited. It rips through. For many victims, the promise of opportunity is what lures them in, whether it's a job in a foreign country, an education abroad, or even a medical procedure that they desperately need. But what starts with hope quickly turns into a nightmare. Many of the victims are never seen again. Some are murdered for their organs, others are left to die after the procedure, their bodies never found. Survivors of the organ trade often live in constant fear, haunted by the trauma of what they experienced. They become isolated, shunned by their communities, who may or may not understand what they have been through. Many develop severe depression and anxiety, unable to move on from the horrors they witnessed. For those survivors, their lives are forever changed. The impact of the organ trade is not confined to just the victims and their families. It tarnishes the reputation of entire countries, and Nigeria is no exception. As stories of organ trafficking emerge, they cast a dark shadow over the nation, labeling it as a hotspot for illegal activity. This reputation has severe economic and political consequences. International investors become hesitant, wary of doing business in a country that seems unable to control its own black markets. Tourists are cautious, fearing for their safety in a nation linked to human trafficking. So, what can be done? The organ trade is a complex multi-billion-dollar industry that thrives on secrecy, corruption, and the suffering of the world's most vulnerable. Stopping it won't be easy. This is a huge market, and the most concerning part of that is this is not going anywhere. The market, the underground dealings, it won't go away, except the government makes laws aimed at protecting its citizens from these criminal networks. And also, except the government wants to deal with corruption in the healthcare sector and other relevant bodies that make this possible. Not until key players in the cartel stop playing their roles these criminal syndicates may continue to thrive. All we can do on our part is to work to enlighten you on the risk involved in selling your organs for profits. We also encourage you to take good care of your kidney so you don't fall a victim to chronic kidney diseases. Thank you for watching. I'm Jude Bella, and this is Declassified on News Central.